Reconnect. Hey, welcome to the show. It was trying to reconnect, so I didn't know if we were there. You look far away.
Okay, I'll come closer.
Like this. All right. So it's another week. Today we have a special guest, Amy Simpson. And as you guys join, make sure you please share and like it. This is really important stuff because these are the patients that we have on that have their lives have changed, and that each person that reverses the condition, they become kind of like a light of hope to all these other people that don't ever get help or don't even believe there is help. So this week, this month, we've been talking about the 15 years of miracle patients, and I thought I would be able to get to some of the really interesting ones because we have like the patient that sweats blue and type 2 diabetes and type 1 diabetes reversed and ulcerative colitis and all these, but with the guests, it's been like a lot of good meat on as far as information. So today, if you have questions, feel free to post them, and we'll try to answer them as we go. But understand that if we don't, I'll always go back and answer information too, and so will Amy. Because Sarah got a whole bunch of stuff. I saw she was like answering them,
She did a good job responding to everybody's questions.
Yeah, and so I guess we'll start out with. We're kind of talking about how functional lifestyle medicine, how we can kind of reverse acute and chronic conditions that we're unable to reverse through most everybody else's experience. And so today we want to focus on like Crohn's disease. And it's a really good one because typically, that's the one. Crohn's is the one that I went to that Harvard post-grad education, and the main one was like they said, Crohn's, you're screwed. You just do meds, and we just do med management and then refer out for surgery. But the natural medicine one or the lifestyle medicine one for Crohn's through Harvard's lifestyle medicine program, that one actually was like, here's what here's the patient with Crohn's, what are they doing to cause it? And so that was a really unique change in kind of the clinical aspect because nobody ever says you can reverse it. So even though we can, it was the first kind of educational program where you actually just made lifestyle changes and then people resumed normal gut function, which was amazing to me. And so I just started doing that with patients. Then we have people like this. So Amy, welcome to the show.
Thank you.
And I saw Sarah already is on there.
Yes.
So that was awesome, and we had lots of good feedback too. So with this, and if you guys see me like looking into the camera, I'm not trying to hypnotize you. I'm trying to read it.
Trying to read your phone.
Read the questions, yeah. So, all right. So let's talk about you.
Okay.
All right.
What do you want to know?
So you're one of our most awesome patients ever.
Thanks.
Right? And so tell us about kind of where you were at before you came in.
Okay. So I was diagnosed with Crohn's in 2007 when I woke up from a major surgery. So they had taken 18 inches of my intestines out. They removed my gallbladder, and my appendix was about to burst. And I had been feeling bad for years and years and years. And so when I woke up, they said, you have Crohn's, here's your medicine. And I basically made it for about 4 years on the first level of Crohn's medication and did fine. Still had Crohn's symptoms, but was able to function okay. And then in 2011, they had to bump me up to mercaptopurine, which is, I find now, a chemotherapy drug. And that's kind of level 2 of Crohn's medication, and I have been on that ever since. I'm not on it now, thanks to you. But
she's drug-free.
I'm drug-free.
Drug-free America.
Anyway, so when I met you, I really thought I was going to have surgery again. It was I met you on December the 2nd.
Well, you remember the date.
Well, because my back went out that day, and I don't know if you remember, but my mom had to drive me, and I met you, and I was bent over halfway.
Oh my gosh,
I was like looking at the floor, and so there was nowhere to go but up, right?
Yeah.
Okay.
There you go.
So anyway, where I was at that point was sleeping 10 to 12 hours a day, taking 2-hour naps, and just felt horrible. I had terrible back pain because I was in bed all the time. There was just multiple things that were going wrong, all related with my Crohn's. But I had a colonoscopy, an upper GI, a barium X-ray, all kinds of tests and blood work, and my GI doctor said everything's fine. So she decided that if I felt so terrible, even though everything looked okay, that she would bump me up to Humira.
Oh, good Lord.
And that's when I decided to come see you. So luckily I had a family member who had already been to see you, who had Crohn's and had been cured, and I decided to give you a try.
Yeah.
So that's where I was when I met you.
So it's Humira or Dr. G?
It was Humira or Dr. G, and Humira sounded, I just didn't want cancer and tuberculosis. I thought you might be a little bit better than that.
So before that, did you know about what I did?
I only knew from our family member because she told me, actually her mom told me exactly what she had to do to help her daughter get cured. So I knew, and I wasn't happy about it because I'm a junk food junkie.
So there was that time of resistance, yeah?
Yeah.
And so it's when they said, this is what we have left.
Right.
Okay, so that's good because that's...
You were my last resort.
That's how I go about dating, too. I'm the last resort.
Oh, I don't think so.
So...
Yeah, you have a cute girl. I've been seeing her on Facebook.
Oh, that's my rock climbing partner.
Well, she's nice. She looks like she's very nice.
Yeah, Shanna's awesome. Or whatever her name is. I don't know.
What are we talking
about? So...
I got him rattled. Look, he's turning red.
No, that's...
Okay, I'm sorry.
All right. So,
So where were we? Okay, so here.
After I give everybody shit all the time, you got me.
Let me pick up where we left off. So yes, so I've never been to, I've never been to a weird doctor, like a doctor that's not your typical run-of-the-mill
Witch doctor.
Yeah, you're like a witch doctor.
A witch doctor.
Yeah, and so, not really, he's really awesome. But I was a little leery to do that, but because of somebody I knew that had such great results. And I've sent several people to you that have seen what's happened in my life, and they too have never been to a doctor that's not just their typical family practice doctor, and they all love you, and they're doing great.
Yeah.
So.
Well, and you know, the way that I practice is like no drugs, no surgery, so you have to figure out how to fix people that way.
But it's not easy.
But so your thing, I mean, that's why I asked that, because there's, I can't tell you how many people that come to me that are like, so who referred you? Oh, this person, this person, this person, over like a year or two. And it's just like, yeah. And then it's like, well, we're going to have to remove your gut and you're going to poop in a bag. And it's like, oh, now what's that guy's name again?
Yeah, what's his name? And that's how I was too. Like, I heard our family member's story a year before I met you.
Oh, it was a year?
And I went...
She resisted a year.
Oh, and I went, oh, well, isn't that nice? Yeah, I eat junk food. I don't eat healthy food. So, and the Crohn's doctors will tell you that your diet has nothing to do with it, which, you know, when you're first diagnosed and you're a junk food junkie, you're like, yeah, I don't have to change my diet at all.
Yeah.
So I never changed my diet, and I lived off of Dr. Pepper and Doritos crackers, and it was great until...
That sounds like college.
Yeah, I didn't go to college. So
you had a college diet, though.
Yeah, I had a college diet.
Well, that's, you know, it's funny, too, because I tell you, I think every single patient that has ever come here and reversed their Crohn's, ulcerative colitis, irritable bowel, they have all been told by the gastroenterologist, all by the specialist, food has absolutely nothing to do with it. And that's the one thing they won't change. And it's like, it's crazy. Like, they... You know, I keep thinking at some point, like, a gastroenterology clinic would be, like, calling me up and be like, can you join our team? Because we're, like, losing patients. Like,
well, and
reverse it.
I even wrote my GI doctor a letter and fired her nicely and explained to her about you. And I did it after I was well. And said, this is how I felt when I saw you last time. And this is how I feel now. And all I've done was stop taking the drug you had me on and started eating the way I should.
Yeah.
And so she wished me well and said, I'll be here if you need me, if it doesn't work out. But I thought, I'm going to let her know that you're out here. I didn't give her your name, but
Okay. So.
didn't want her to hunt you down.
Well, so for a year, you said there's no way in hell I'm going to do that.
No way.
That's so crazy because you saw the other patient just be like, and she's like night and day.
I know.
Yeah.
But I saw all the work that her mom had to go to.
She did a lot of work.
Yeah, and I'm like, I don't have time for that. I'm not doing that. And I didn't like healthy food before. Like, vegetables were not my friend.
Yeah. Yeah. That's a pretty common theme.
Yeah.
Because we're Americans. The average American only eats one fruit or vegetable a day.
Mm.
Isn't that crazy?
That is crazy.
So, yeah. Oh, so we have... Shanna says that's amazing.
She's talking about you.
I know.
I'm going to get you laughing.
Maybe. No, you gotta get me all
Hello.
embarrassed. So, you talked about all these other kind of problems that you're having that were not gut problems, but right? So I taught anatomy and physiology for 6 years, and one of the things that I just always harped on was that everything you eat, like if you eat a really healthy diet, nothing in your body gets better unless it absorbs.
Right.
And so someone could have a crazy healthy diet and still have neuropathies and migraines and all these fatigue and all these depression things fall apart. Because just because food goes in doesn't mean it absorbs into our body, right? And the mess up thing with Crohn's is one of the things at Harvard that really blew my mind was they said that for people who have celiac or even non-celiac gluten sensitivity, which is most everybody, it takes 1/50th of a slice of bread, so like one crouton, to change the absorption rate in your gut from an entire football field to one end zone.
Wow.
And so all of a sudden when people have that, they start having all these bizarre symptoms and nobody can figure it out. They'll be going to 10 different specialists and no one's saying, well, it's probably just malabsorption or malnourishment syndrome. That's all it is. Yeah. Fix the gut and you fix the rest of the body, right? So tell us about that, with you. So you were telling me a little bit about kind of all the complications that you were going through that were not just gut.
Right. Well, I mean, depression was a huge part of Crohn's for me, and mainly before I was diagnosed with Crohn's. I spent years diagnosed as depressed, bipolar, anxiety, and right before I had my surgery in 2007, I was so sick, and no one would believe me, that they ended up just loading me up on 3 different medications for that. So I gained 40 pounds, and our motto was better fat and happy than possibly not here, because I was that depressed. So, when you have Crohn's or any chronic illness or an autoimmune disease, what happens is you can't function like a normal mom. You can't function like a normal wife. And then it gets in your head because you don't know why. If you're not diagnosed yet, your brain is just thinking you're a loser and you're lazy and you have no energy and you can't figure out what the deal is. So when I woke up from my surgery and was told I had Crohn's, that took my depression away right there, just knowing that there was an actual reason for it. And so that was wonderful. And I think that even though the medication didn't make my Crohn's symptoms go away, I still had the lovely, going to the bathroom all day long every day thing, but I was so happy to not be depressed that my new normal became all the Crohn's mess without depression, which just was so much better.
Yeah.
So that's how I lived for all these years, was, all those commercials about, are you looking at the back of the bathroom stall during the parties? Yeah, that was me. Do you eat and have to go to the bathroom right away? Yeah, but I kept thinking, but I'm not depressed anymore because I know why I feel this way. Yeah. And so, but now that I've met you, I don't have any of that. I don't have, the extra back pain from laying around for hours because, you're exhausted when you have Crohn's because your body's not absorbing the food and things like that. So. Well,
I remember that was one of the complexities because it was just you kept saying that standing, it was hurting your back all the time. You had to lay down.
I was in severe pain from head to toe, all the time.
And then it turned out that it really wasn't really back pain. It wasn't structural. No. It was just all the malnourishment, all the weakness. Right. Yeah. And
the lack of activity because I was so inactive and because I laid around so much. I think if you put a healthy person in a hospital bed, they're going to get sick.
Yeah.
Because if you just lay around, you're going to start hurting, and then you're going to get weak, and you're not going to be able to do anything. So, are people saying stuff?
Yeah. So what are they saying? So Suzanne says, "Oh no, she just shared."
No, how am I supposed to give up gluten when I'm Italian?
Hey, Italiano. Hey.
I know. You are going to learn to love tinkyata brown rice noodles. I ate a big old bowl of goulash tonight, and I had spaghetti 2 days ago, and it was wonderful. But you do have to give up going to Italian restaurants.
Yeah.
But you can cook that, and I promise you, because I don't like food that doesn't taste like what it's supposed to, that it tastes just like regular pasta. So.
Yeah, it really does.
It really does.
Yeah, I was amazed
nothing
by that.
else does, but the am I saying that right?
Yeah, tinkyata.
Tinkyata.
Sounds inappropriate, but
Sounds like think you oughta. Think you oughta try this pasta.
hey,
Yeah,
that's
think
an
you oughta-
Italiano.
yeah,
Hey,
think you oughta try this
tinkyata.
pasta. So
I
yeah,
like
it's
that.
really good. But yeah, I thought I would have to give up all Italian food, all Mexican food, because I can't have corn. But I have figured out how to make it work. You just have to get creative. So.
And Rachel says, "Can you spell the name?"
Tinkyada.
Holy crap.
Because I was making goulash and I tried to remember to look it up.
Okay.
And you can usually only find it in the health food stores, or you can find it, if you're in Wichita, you can find it in Dillon's.
Yeah.
In the health food part of Dillon's. But
Yeah.
other than that, I don't usually find it in normal stores.
No, I saw it at Walmart, and
Did you?
but it's like, that's the thing. It's like $4 or something. But if you go to the Asian stores, you can get that brown rice pasta, and it's like 65 cents or something like that.
But is it tinkyata?
No.
See, I'm a
tinkyata.
tinkyata girl. Yes, I'm the tinkyata girl.
That's funny.
Yeah.
Well, Sarah Young,
Mm-hmm.
she says she loves her brown rice pasta and homemade a marinara.
Homemade a marinara.
Yeah.
Sarah's an awesome cook.
Sarah hasn't really shared any of that with any of us, so...
No.
She shared that with you?
Thank you, Rachel. You're right. There you go. I think I spelled it right. Tinkyata.
Yeah.
I used to call it Tanganyika pasta because I couldn't remember what it was called. I'm thinking of the zoo. So.
That's right.
Yeah.
Well, and so you found ways to survive. So I guess one of the things, too, that we do with all the patients, and you did it, too, which is you did a test that makes everybody cry.
Oh, I cried a lot.
Did you cry?
I cried.
Did you hear Sarah?
Yeah.
She said she went...
I cried up and down. Well, I warned Sarah, because we're really good friends. We've known each
Yeah.
other for years and years and years. I warned her, you will cry in the grocery store. It's like you're going to your food funeral.
Yeah.
You walk up and down the aisle, and then you see something that you didn't think of that you'll never eat again the rest of your life, like a Hostess white donut.
Yeah.
And you're like, never. I will never eat that again.
Yeah.
I love those little donuts.
That's...
Yeah.
I lived
Is that
on those.
my list? Or that's
No,
just
no,
a
no.
list?
I think that's mine.
Oh,
But this
okay.
is what that looks like. If it's probably backwards,
Is that working?
maybe. But so like when for any kind of like autoimmune disease, we always do that IgG food sensitivity, and so that one has like 184 foods. So it's like a lot of foods, and you can see on this one it has lots and lots of red. So all the red ones you can't have. And if you have Crohn's, then we back it up to equivocals, which then makes it even rougher because
Right.
But if this is one of those miracle tests, though, for like Crohn's and ulcerative colitis and irritable bowel, because with all autoimmune disease, it's just what's called T cell dysregulation.
You told me.
So when I drew all that out, did it make any sense?
I tell people the drunk T cell story all the time.
Do
I
you
like
really?
get out my guns and I talk about how the T cell came into the bar and he got drunk and then he couldn't tell who was the real food or not. And I love telling that story.
That's awesome.
Yeah. So I totally understand T cell dysregulation and I explain it to people freakishly often. And
That's awesome.
yeah, and kind of the molecular mimicry, which is hard to say, but that all fits in together.
Yeah.
And so, but that's how I get people who think I'm crazy. I say, well, let me explain it this way. And once you tell them about how your body attacks your food that you're eating,
Yeah.
and that's why this list is important, not just eating healthy.
Right, because there was a neighbor of one of my friends, and she is just like wasting away with Crohn's, right? And they were like, well, you got to go see Dr. Garrett. And she was just like, well, we've already done food stuff, and we already eat healthy. And she was like, well, no, it's not that. But that's what people think a lot of times.
Right.
That it's just like, oh, if you just eat healthy, but what healthy is for one person isn't the same for the other.
Right.
I mean, there's general like wheat and dairy that you want to stay away from, but like this one here, and I don't. Oh wait, no, you know yours by heart.
I live that way because I don't cheat.
And Donna knows mine by heart because if I go off of it and post food, she gives me crap about it.
Donna doesn't cheat either, right, Donna? And that's all we're going to say about that.
And so, was it, Rachel asked, does every Crohn's patient have all the same restrictions? No, it's wildly different. And so that molecular mimicry that ends up causing that autoimmunity or causing the Crohn's or ulcerative colitis, it is wildly different from patient to patient. I can blanket, and I probably told you from the beginning, it's wheat and dairy.
Right.
It's always wheat and dairy.
I saw a difference. That's the first thing you tell people when they come, just so you know if you're going to come see this guy. I'm assuming it doesn't matter who you are, even if you came in with a splinter, you would say, wheat and dairy.
No wheat and dairy, no wheat and dairy.
But the first thing he tells you to do, and you cry the first week while you're waiting for your blood test to come back, is no wheat and dairy. And immediately, and I mean within hours, all of a sudden I was no longer bloated and no longer gassy, and my husband was happy about that, and I was amazed at just those two things. And that's a mourning process in itself.
Yeah.
The no wheat and no gluten and no dairy, that I probably, it's probably half and half. I cried all about that, and then a couple weeks later I bawled about having
when you
learned.
get the rest.
Well, then I had to, it wasn't so much when I had to eliminate more foods off of my list, it was that I had to learn to like health food, which I thought I could never do.
Yeah.
So it was when I saw the list of what I could eat, looking at it, thinking, I've never eaten any of this before, and I hate it all. And now I love it.
Yeah.
But I had to learn how to eat.
Well, and there's that cycle, too, of like, you're stressed out, you're in pain, you're discomfort. So then you choose to eat things that have morphine in there, which is wheat and dairy, and that kind of comforts you, but then it makes you feel sicker, so you have more pain and discomfort. And so it becomes this cyclic thing of like, that's your crutch. Even though it hurts, it's like that jerk boyfriend in 8th grade that was mean to you, but you loved him so much. It's just like this pain-love kind of relationship with food a lot of times. But wheat and dairy, I'd say wheat and dairy for almost all kind of conditions is probably like at least 50% of the resolution.
Yeah, I think so.
So besides that, what were the ones you never expected?
Well, I pretty much can't eat any nuts, and so I can't eat any nuts. I'm not supposed to eat any beans, and I don't cheat.
Oh, but there's a button here.
I am not a cheater, but black beans and pinto beans are not on the list. And even though I've heard rumor that they're related to other beans, I'm pretending that they're not, and so I do eat those two beans. Yeah. Because they're not on the list.
But you're Crohn's free.
But I'm Crohn's free, so I'm going to bean that up because I'm a burrito bowl. I mean, I eat burrito bowls all the time. Yeah. So yeah, the Blue River Grill at in front of Cabela's. Do you know about this place?
Oh, so I've seen it. I've never been there.
You need to go there.
Why's that?
Because my friend Ed owns it. Number one, Ed Lemon owns that. So if you're a countryside person, you know him. And it's amazing. And I have been eating there from day one. And you can build a burrito bowl. And it's so good, and it's never made me feel bad that I'm not brave enough to ask that important question about, is this all grass-fed and all that? But, when you have to eat out for lunch quick, it's a great way to get filled up, and you can choose everything's fresh, and you just go down. It's like Chipotle, but I can't do Chipotle.
Oh, you can't?
I'm not saying Chipotle's bad. I'm saying it's bad for me. There's something in Chipotle that my body says we're not keeping this. Yeah. So... But Blue River Grill is amazing.
Awesome. Well, I'll have to go there.
Yeah.
The beans and the nuts. So that's not milk. So what'd you do about milk?
Yeah. Well, here's the deal that I will warn people. So when you start seeing him and he says no gluten and no dairy, you're going to go shopping and spend a bunch of money on every gluten-free and dairy-free product. And you're going to get really excited because you're going to find weird cheese that you can eat and weird mayonnaise that you can eat, and all this weird food that tastes good enough, and then you get your list and find out you can't have any of that anyway. So that's what makes you sad, is you're like, ooh, veganese. Is that how you say it, veganese?
Yeah.
Yeah, and I can't have that.
The Chipotle Veganese?
Yeah.
Oh,
And so,
that's so good.
So you find all these substitutes, because I literally was like, here's my Dr. Pepper, what are we replacing? Okay, I'm going to drink kombucha. Here's my, here's this, what can I find that looks like it and tastes like it? So I was trying to replace, mentally, that was how I was going to cope.
Yeah.
But then when you get your food list, there's so many sneaky things like coconut. And I'm like, who cares about coconut? Coconut is in everything. And it's in every
Oh, that's right.
thing.
You were the coconut one.
You're coconut too. I know that.
Oh, crap. Am I?
Yes, you are.
I stopped drinking coconut milk.
That's not
But yeah,
good.
so...
You got to stop eating all that. Is it Indian food that's got a lot of coconut?
Mumbai Grill.
Yeah.
They're out of business now.
Oh, no.
Yeah.
Did you...
I stopped eating their coconut milk and they were like, we're out of business.
Yeah.
Okay. So there's the food part with the coconut, but also you were trying to get rid of it from all your products.
Right. We were also, I guess I should shout out to my husband, Mike. Hi, honey. That he, just to be supportive, he doesn't have Crohn's or anything, but just to be supportive, he did the food test too, since I was already cooking for myself that way. And he had some sensitivities too, so he feels a lot better, even though he just feels less inflammation and can kind of pop out of bed quicker, and just in general feels a lot better.
Yeah.
But he's allergic to everything in beer. And that's bad.
What about rice beer? No?
But he's allergic to brewer's yeast and hops and barley and millet and everything you possibly would use for any beer. So
yeah,
it's sad.
Poor guy.
I know, poor guy. But he doesn't have Crohn's, so he has beer every now and then. That's fine. That works out good.
Yeah.
But what was your original question? I got off on a tangent.
Oh, some of the things that you didn't expect.
Oh, no, you were talking about the household products.
Oh, yeah.
So we decided that my husband and I, that we would not only do food, but we would also try to cleanse our house, kind of like Sarah said last week when she was on the show, of all the toxins, and also for us, all of the allergens.
Yeah.
And so that's not easy.
I know.
Because
I remember you going through that.
Well, the big thing is we're both allergic to nuts, and every good product has some kind of a nut in it.
Yeah. And
we're both allergic to coconut, and every wonderful, healthy product has coconut in it.
Yeah.
And so, and we're allergic to sunflower, so that there's things on your list that you'll think are no big deal, and they end up being a huge deal breaker.
Yeah.
And other foods, that, like I'm allergic to asparagus. I'm like, ooh, good.
Yeah.
Never want to try that. But yeah, just weird little sneaky things like safflower and sunflower. If you're allergic to those, you have to become a label reader, which is huge. What does Miss Sarah say? I eat at Blue River great veggie bowls too. Oh yeah.
Yeah.
Yep. Sarah's an example of somebody. So I was a junk food junkie.
Uh-huh.
Barely ate anything because you don't need to eat much when you're eating junk because it fills you up really quick.
Yeah.
So I would eat enough to be full for 2 hours at a time, and that was it. And I ate waffles and milk before I went to bed every night.
Waffles and milk?
Waffles and a big old glass of milk. So, so Sarah, though, she, as long as I've known her, has been a really healthy eater.
Yeah.
And she was even doing, I think, a ketogenic diet. So, and to think how sick she was on that proves to you the importance of the food sensitivity.
Yeah.
Because even though she was eating everything healthy and she was eating a minimal amount of food, even it wasn't what her body was, wanting her to eat.
Yeah.
So that made a huge difference. So.
Well, some of those things can be crazy inflammatory.
Right.
Like even this beginning of the summer, I was coughing all the time because
I remember that on your show. You kept coughing.
It's a stupid coffee, but I thought I got rid of the coffee, but then it still persisted. So it was ended up being green tea, and I was drinking green tea all the time. But I'd always get that tickle in my throat. And then almonds. My friend bought $60 worth of nuts for me, and then
you just have to put them in little packages and gift them away.
I know. So I had to get rid of half those.
What'd you do with the other half? Eat them and just cough?
No, I ate cashews. So I kept the cashews, but she got me regular almonds and the almond slivers, and I couldn't eat almonds. And so then I had to give those to a friend.
Yeah.
So
sometimes you got to do that.
Yeah.
Sometimes you have to have a party and buy food that you can't eat, and then you send it home with the people that came, so you don't ever eat it.
That's right.
I did that last night.
Did you?
I bought M&Ms for my friend Lori, who likes to eat food coloring. No, I'm just teasing Lori. And then I bought some cream cheese dip for some fruit, and I sent it home with the respected individual, so I wasn't tempted to eat.
Well, that's very good.
I'm not ever tempted to eat anything, though.
Yeah.
So.
Is it because of how bad Crohn's was?
It's because if I eat something I'm not supposed to, I feel bad.
Oh, yeah.
I get a headache.
Well, yeah. So, people say all the time, like with patients that like overcome these horrible, horrible things, and they're like, well, how long do you have to eat like that? Or, poor you.
Mm-hmm. Forever.
But it's like, but I feel good now.
Yeah.
And there's times where I'll cheat and I'll eat wheat like once in a while, and I feel like, oh, I gotta go take a nap, and like, why the hell?
Right.
Like, it's not worth it. Like in your brain, somewhere in the back of the brain, it says, man, if you eat that, you'll feel awesome like you did, 10 years ago. Mm-hmm. But now you don't. It doesn't happen anymore. No.
So the other aspect of this, besides food, that I found was really important, and these are things that I was not doing. Because the food made me feel better, I was able to start exercising.
Yes.
So for me, because I had such terrible back pain, I started going to the chiropractor more than once a year. So I literally, he would look at the chart and say, it's been a year. So I try to go once a month, once every couple of months, and then you connected me to a great massage therapist, Renewal Therapy, Rachel Olson in Newton. Rachel, and she's wonderful.
Yes.
And so
she drives all the way to Newton.
It's worth it.
To see Rachel.
You can go 80 miles an hour to get there. The speed limit's 75. Okay, you can go 75 miles an hour. You can go 75 miles an hour unless you go 5 over like I do.
And if the cops try to pull you over, I found that if you just take a gun and put it out the window and fire a few shots off in the air, they'll back off. They'll leave you alone.
No.
It's a Texas thing.
That's not a good idea.
That's not... Oh, okay.
I've heard... Well, I'm not going to tell you what I've heard. That's gross. Okay. Anyway, so I started exercising. So I started with yoga because I knew that was good for me to stretch. And I did the chiropractor, and then I started getting a massage, which it seemed crazy, like, why am I going to pay for a massage? But I thought, I'm not going to go to my regular doctor. I'm going to see you, and I'm going to do what I need to do for myself. So exercising, chiropractor, and massages really were huge. And then the other element was starting to take all the different supplements.
Yeah.
And so that's a huge thing, too. And at the beginning, you had me taking a little bit more than I do now just to get healed.
Yeah, get you, like, feeling good so you can make changes.
Right.
Yeah.
So it wasn't just food, just so you know. It's not just food, but food was the very first part. And then everything else, as I started feeling better, I was able to do more and more and more. And then I ran a 5K race on Saturday with Miss Donna Payne.
And
Yes.
I've been following you guys on the Couch to 5K.
Yes. She shamed you into running.
Donna shamed me and gave me shit until
Yeah.
I signed up for the Tough Mudder and did the fight. And I know I was catching up to you guys. I love it because I was like running every day.
But you're not supposed to. Did she tell you about that?
Yes, she gave me crap.
Yeah.
I was like,
she's my boss.
She's a rule follower.
She's my boss. I'm pretty bossy, but Donna's my boss.
She's like,
Yeah.
I said, hey, I'm almost catching up with you guys. She's like, you're not supposed to run every day.
No.
So,
Yeah.
but like I run with Shannon, and she likes to run every day. So I was like, oh, that's fine. That's what I'm doing.
Yeah.
But
well, she's probably been running every day for years and years and years. But I think, like, for Donna and I, because we're going from the couch, literally
from the couch.
Like, well, we were walkers, but not runners. Now, I have to give Donna credit, though. She's ran a half marathon before.
Yeah.
So she's way tougher than I am. But yeah, to do the couch to 5K, it really takes a couch potato to running a 5K, and you really have to have a day in between each run.
Yeah.
That's why there's 3 for each week and not 7 for each week.
Well, I couldn't figure out how I was getting put through the week so fast.
Yeah, I know.
That's funny.
Oh, I have something for you.
Oh, you do?
I do. I don't know if they can see this.
Oh.
I'm going to give Dr. G my race number.
No way.
I am. On the back it says, I dedicate my first 5K. I should have said only because I'm not running anymore. My first 5K race to Dr. Garrett, who made it possible. So there you go.
Oh, thank you.
You can hang that on your wall with your, I think you have 38 diplomas on your wall. Yeah.
It's a nerd factory in here.
It is a nerd factory, but that's cool.
I appreciate that.
There you go. I kept my medal, so I have a memory,
Yeah.
but then you can keep that and lose it somewhere in your office.
But you had to, no, I'll put it up. But you had to do it.
I had to do it.
Hell, I'll put this, well, you put your name on there.
I did.
then people think I ran
No,
this.
see, that's why I did that.
And it has a woman on there. Is this
Yeah.
for women only?
This is a great race. Let me just plug this
All
really
right.
quick. So the Race for Freedom is every year. It's in September, and it's put on by ICT SOS, and Jennifer White is the founder of that organization. And they raise awareness for sex trafficking. And so
okay.
every year, the money that they raise above and beyond the cost of the race, they pick a different charity. And I believe this year it was the Wichita Sexual Assault Center got all the proceeds. So they had over 1,000 people registered this year. It was the 6th annual race. Yeah. So it's awesome.
So you know, Wichita is the hub for human trafficking.
Mm-hmm. Isn't that crazy?
That's unbelievable.
Yeah.
Well, that's awesome. So you
seems crazy that we're just in the middle of nowhere.
I know.
And
so that's awesome.
So there's your present. I was going to make avocado pudding and bring it, but I thought you would like that
That's
better.
right. Yeah.
So.
Well, that's awesome, and that's that's the inspirational thing of like looking at kind of where you were. I mean, you couldn't stand up at the counter and chop vegetables without falling apart.
I couldn't even walk in your office without my mother driving me to your office.
That's crazy.
I know. And now I can leap like a gazelle.
Yeah.
I'm going to try to do a cartwheel, maybe.
In here?
No. There's not enough room. The last time I did a cartwheel, I was probably in my 30s.
Yeah.
And I heard every bone in my body go all the way over. And when I landed, I went, yeah, we won't be doing those anymore.
Yeah.
So maybe I'll do one.
Awesome.
Yeah.
Well, it's got so as a mom and a wife and as a person, like you feel like you got your life back.
My poor kids, they're grown boys, and they're not too happy with me because now I cook all the time. And they're like, ooh, that would have been nice if you'd have cooked for us when we were kids. They're like, man, you're really a good cook now. You hardly ever cooked when we were kids. So, hey, Cooper, Morgan, and Grant, hello. So, yeah.
That's awesome.
It is awesome. I am not 20, but I feel better than I did when I was 20 years old.
Yeah.
Like, my mind is clear. I feel like I can just go.
So
I don't need a nap.
Isn't that nice?
I was taking a nap every day. Every day I had to take a nap just to function. Just to make it to 10 o'clock, I had to take at least an hour nap, if not two.
Yeah. Well, and Jess had a question, too, on there. Do your food, it's long past, but do your food sensitivities change over time? And
I hope so.
Yeah.
I'm going to have you retest me in December because I was tested in December.
It was, so that's a year.
Yeah, it'll be a year. You said 9 months to a year, but I want to give it a year. But because mainly just for the little things like the sunflower. I only have 2 kinds of potato chips I can eat, and I'm almost tired of them.
Yeah.
But every chip is made with sunflower.
Yeah. No, almost every typically what you want to see with like Crohn's, ulcerative colitis, eczema, psoriasis, any weird autoimmune thing, especially when they're severe, is that everything on there is just a mess.
Right.
And then if you do the long-term stuff, which is get rid of the chemicals that mess up your immune system, get rid of all, try to stop exhausting your hormones, and so your liver stops producing a bunch of sugar that then suppresses your immune system, and then don't eat 150 pounds of sugar like most Americans that suppress your immune system. And if you stop doing that, you should stop causing the T-cell dysregulation, and then you're able to normalize and get rid of those memory cells. And then when you retest in like 9 months to a year, you should see a big change.
And then your T-cell dudes aren't drunk anymore.
That's right. That's right.
They're all sober. They have been to drug rehab through your diet.
And we've had like some of the worst, like the gastroenterologists be like, "You're the worst ulcerative colitis we've ever seen in our whole practice," And the next year, they'll get back half their stuff, and they're just like happy. They could care less about the rest. They're just like, once you get coconut back and you get almond back, and you get
there's just a few things that are key.
Yeah.
I would never eat gluten or dairy again.
Right.
Even if it came back that everything was marvelous, no way. I just wouldn't do it. You've got me brainwashed into thinking dairy's the devil.
Dairy's the devil.
Yeah, but I mean, to me, I know how I felt and I know how I feel now.
Yeah.
And I know that if I were able to eat my junk food again, I would go right back and eat my junk food because that's just who I am at heart, as a junk food junkie.
Yeah.
So, like like, Sarah eats really, really healthy, and sometimes she eats food. I'm like, oh, I couldn't do that. And I eat way healthier than I did. And I eat about 3 times as much food now as I ever ate before. Like, I'm literally holding my fork ready to stab my husband's hand if he tries to get food off my plate now. To where before I would eat 3 or 4 bites and pass it over.
Yeah.
So, but I think if I had foods come back to me that could qualify as some junk food business, then I would probably start eating less and eating more junky food and end up in the same place. So I almost wish you could just say, can you only test like sunflower? So that I don't know if everything else is better.
Well, and your family member, I think she's going to be coming on the show because she's an amazing case too.
Yes, she is.
She figured out how that girl was just awesome because she looked at she lost almost, I don't know, like 3/4 of the food on there.
Yeah.
Like it was really bad.
I never saw her list, but I imagine it was really, really bad.
Yeah, and so I thought there's no way she'll do this. And then she was making like marshmallow poof stuff. Mm-hmm. And she was just like, okay, can't have this, but I can substitute. And she
like
figured out how to solve all her junk food needs.
Yeah.
And not cause her Crohn's.
That's
like, it was amazing.
I really just need to go spend time with her, really.
Yeah. I told her she needs to do a video blog.
I know.
Like, that was great.
I'm amazed, like, on Dr. G's Neighborhood, where people share recipes, which is great. And it doesn't mean that it works for everybody. Somebody will post something, like Sarah put something on there a couple of days ago that looked really good, but then Donna commented, but I can't have beans. Oh, it was when she was on your show. She was talking.
Oh, that's right.
Talking about a dip that she makes. So it doesn't work for everybody, but it's so nice to see all the different ways people have gotten around their list to create something that mimics a food that you used to like. But instead of it being junk, it's actually made out of good stuff.
Yeah.
Like we can't have dessert. Mike and I, there's no dessert we can eat. So we eat dark chocolate, and we hated dark chocolate, but now we eat it all the time. And we can have sorbet. Those are our only two, like, go to the store and buy a dessert.
Right.
That's it. And so, but I figured out how to make avocado pudding. And it sounds disgusting, but it's
chocolate
really,
avocado pudding?
You can make chocolate too, but actually just regular avocado pudding, because it's just, you can just look it up. It's out there everywhere.
Yeah, it's very...
But it's an avocado, and we use rice milk, so whatever milk you can drink. You had asked that earlier, so when you can't do nuts, you do rice milk.
Yeah.
And then you either use maple syrup or honey. And all it is those 3 things. And you can blend that together like in a little food processor, and I cut up little strawberries and put a little bit of organic sugar on there.
Yeah.
And it's yummy.
Awesome.
It's really good. And you can make it up into cute little parfait glasses and make people eat green dessert, and they do it. I have fed it to people who don't have to eat like this, and they're like...
They didn't know.
This. Well, they knew.
Oh, they knew?
Well, I told them.
Oh, okay.
Who do you serve green pudding to and not tell them? They're going to be like, what is this? But they all liked it.
Yeah.
Yeah. So that's our other dessert when I feel like actually whipping something up.
Yeah.
But yeah, I love pudding. Can't have pudding.
Well, and it's funny to think of like all the stuff that you would have never thought of eating before.
Yeah.
But then when you can't eat that junk food, then you're just like, yeah, this stuff I wouldn't eat. Like now that's like awesome.
You know, our number one snack is prunes.
Is that right?
We're like old people. We keep them in our pocket. Individually packaged prunes.
Oh, that's very nice.
Yeah. So prunes are our go-to starvation snack. Like, we always have prunes in our car. When we go to a game, like we love to watch the Shockers, and you cannot take food in there, and we can't eat anything in the stadium, we pack our pockets full of prunes. People are eating popcorn, hot dogs, and we're just like popping our prunes and drinking our water.
Yeah.
So, because, you know, that's one thing that I didn't think about is when you go to a sporting event and you cannot bring food in, there is nothing good for you in those places.
No.
Nothing. No. And so it's all gluten and dairy and bad stuff. So.
Yeah. Well, and what were some of your solutions for, like, going out to eat?
At first, I didn't go out to eat at all because I was panicked and crying all the time. And so I cooked and cooked and cooked for hours and hours and hours. But our lifestyle, we travel a lot because we're empty nesters. And so little by little, we just started learning how to eat out. At first, our go-to thing was a hamburger patty. So wherever you go, you can always get a naked hamburger. And then I learned that when you're hungry enough, you will eat that ugly piece of lettuce that's on your plate that's supposed to be for decoration.
Garnish,
I'm literally just like, can I have another one of those? So I asked for, extra condiments and things like that. But and we eat a lot of salmon when we go out.
Yeah.
And I'm usually pretty willing to ask questions and ask for special, can you take this out, take that out, and ask how things are cooked. So.
Do they handle it pretty well?
They really do, but sometimes they're not. Sometimes the waiter or waitress is not real. They're not real savvy on the word dairy. So when you say, "Does this have dairy in it?" their brain says, "Does it have milk in it?" No, but they're not thinking about butter. They're not thinking about yogurt. So a lot of times you'll order something and the menu won't say that there's dairy, and then it'll have a really beautiful little line of dairy all the way across your plate, and you just kind of scrape it off and hope you don't get a headache.
Yeah.
So that's the only time that I accidentally cheat is when we go out to eat, but we eat out a lot.
Well, and I think we see this with patients all the time where you have this much inflammation going on, and then you get it down to here, and then those little cheats are survivable. You don't get Crohn's again because you messed up the restaurant.
Yeah, and we go on motorcycle vacations to where there is.
That was I remember that was a big challenge for you.
Yeah, we went in June to the Grand Canyon, and to survive for, I can't remember how long we were gone, 10 or 11 days, eating out every meal.
Yeah.
Now, I drove a minivan because I'm not tough, and I had a bucket of snacks and a cooler full of snacks, but I didn't have any meals, so we ate out every meal. And you were talking about how some food is kind of like crack cocaine or things like that.
Right.
When we would go out, one of our go-to foods is fajitas, because you can order those without cheese and without the tortillas.
Yeah, that's good.
And as long as you can have everything in it, your only possible problem is sometimes they will dredge it in a flour, or they'll have taco seasoning on it with gluten in it. But you never know, so you take your chances. But when you're eating fajitas and they taste like crack, you can be pretty sure that they've got gluten on them. So we were in Vegas, and I ate an entire platter by myself while Mike watched me because he had already eaten. And I was just like, these are the best fajitas in the whole world. And then I went, oh, these have got to have gluten in them. And sure enough, boy, it was like 2 hours later, my body was like, we're not having that. So, but yeah, fajitas are a great option. If you can have onions and peppers and beef and chicken and shrimp, you can kind of pick and choose what you want. And you just learn at different restaurants who does and does not have gluten.
Yeah.
Most of the authentic Mexican restaurants, they don't really dredge their stuff in taco seasoning.
Right.
It's usually pretty much like they threw some meat on the grill and threw some chicken, and it's pretty dry, and so you don't have to worry about it there. But yep.
Well, let's see. So so Jess had a question about vitamin testing for mineral deficiencies. You can do that. It's very expensive, but typically we don't, because we just tell people to eat real food, and you get more vitamins and minerals you'll ever need. So usually that's just, I don't ever waste money for testing if we're just going to fix it with the treatment anyways. Although you can.
It seems like you usually figure that out, though. Like after people do the food stuff, if they're still having trouble, then you're usually to pinpoint, like, hey, maybe this is caused because you're deficient in vitamin D. Like, you need a little more than your food.
Yeah.
And you have, correct me if I'm wrong, but in your packet of information that you go through with everyone, you kind of have a set small list that you'd like everyone to take. The B complex, the B vitamins, the fish oil, and the probiotic.
Right.
You say those are basic for everyone who walks in the door.
Because those are your fastest fake it till you make it. But then eventually you get to the point where you really don't need those, or you just kind of use them as needed. So.
Well, maybe I need to ask you that because I'm still using them every day.
Well, yeah, you probably don't need them at this point.
Yeah.
But it's just, you just want to keep things on hand. So, like, I use B vitamins all the time. Or not all the time, but once in a while, if I'm, like, not getting enough sleep, or if I'm just trying to really run myself ragged or something, then I'll just pop 3 or 4 B vitamins, B complexes, and then suddenly I just feel great all day long. Or if I'll take methyl B12 occasionally instead of B complex. And then once in a while I'll take a probiotic if I don't feel like if I feel like people are getting sick around me.
I take it every day, but I feel like being a Crohn's girl, I need to take a probiotic. And I drink kombucha every day.
Yeah.
And I try to do fermented foods, but
you make your own kombucha, right?
I do.
Yes.
It's so sour, Mike can't drink it, so I have to buy him.
That's how I do mine.
Mike says mine tastes like vomit.
That's
when it's just right, when you can barely drink it because it's so disgustingly sour.
Yeah, I made mine a few times where like it took my breath away.
Yeah.
You do yours that way?
Yeah, but the only thing I don't like about making your own kombucha, and I still think everybody should make it, is I don't like the loogie that ends up in your mouth, because
the little tiny baby. Oh, that's the best.
It's like somebody spit a hawker in your kombucha and then you just drank it.
You're gonna gross everybody else out. They're not gonna do it.
Just go to kombucha class and you'll get grossed out when you see the SCOBY, and then you'll get over it. When I came to class the first time and I looked at that, it looked like you had brains in a jar.
Yeah.
And I was like, I'm not even going to do this. There is no way I'm going to do this. And then you gave me one, and I took it home and just kept watching it and looking at it like, I'm not doing this.
Did you really?
I did. I'm like, I'm going to throw it away. And then I did it, and I loved it.
Throw it away.
I was just like, I can't. It's like a pancake.
It's weird.
It's like a floppy.
Yeah.
But I kept telling myself, this is like friendship bread, that started way
That's
before.
right.
And
That's
it's such a lovely thing, not a disgusting symbiotic colony of bacterial yeast. Is that what it is? Oh. And now I have SCOBY babies and I give them away.
Yeah.
Yep. So kombucha's cool and fun to make.
And so that's funny that you hesitated, because I have a few other patients that they're all like, they make kombucha because you made kombucha.
Mm-hmm.
Yeah.
Yeah.
That's awesome.
Yeah. It's fun to make.
Yeah.
I like it.
So what would you tell people that have Crohn's or ulcerative colitis that don't think there's hope?
I would say the best advice I would give anybody with Crohn's or IBS or anything that has to do with your gut is, for free, stop eating gluten and dairy. And that doesn't just mean bread. I mean, you have to read labels, and you have to understand what gluten is, and you have to understand what dairy is, and be serious about it. And don't believe your GI doctor or any doctor when they tell you that your diet doesn't matter. And I know it sounds like fun for your diet to not matter, because then you can just keep eating your old terrible ways. But that's free advice right there. It's not easy, and you will be sad. And I was fortunate to not have any kids at home when I was doing this, so I was just in charge of myself and my very compliant husband. But it's not an easy thing to do. But I would challenge you to try that for a month and see if you don't start feeling better. And then that'll make you feel just good enough that you'll want to come see this guy and get your food sensitivity test done. And then cry a little more. But it's so worth it.
I don't know why I laugh all the time when people...
It is. Did you not cry at all when you got...
No, I don't...
How many times have you had your list done?
I did it twice, so I did it...
I think the first time you just looked at it and threw it in the trash, because...
Well, I was like, I can't have those things, so I just don't eat them.
Yeah. I think there were enough of
but
us
I cheated a lot.
giving you a hard time.
Yes. On mine, I cheated a lot, because I'm a guy. And so, like, the idea...
And you don't have Crohn's.
Right, and that's the thing, is I felt really good almost all the time.
Yeah.
And once I started having problems, or actually, there were times where I'd get really strict and I'd get rid of them, and I just felt great. Like I felt like I was good already, but I felt great. And then it was just like, well, okay, I could feel better. But
the want to is not there.
Yeah. But I still had the brain addiction
true.
stuff.
And I do tell people that. There's a lot of people that have seen, like, I lost 20 pounds within 2 weeks, and I wasn't doing it to lose weight, but I knew I was carrying 20 extra pounds. I'd been carrying it. I gained 40 from depression medicine, lost 20 during my surgery, and was carrying that 20 all this time.
Yeah.
And so a lot of people see me, and the first thing they think is, oh, you've met a doctor that helps you go on a diet to lose weight. I want to go. And it's like, it doesn't work that way. This had nothing to do with losing weight.
Yeah.
This had to do with feeling better, and it just so happened, in my case, that I shed pounds. And like for Sarah, she mentioned before, she had a chronic period where she gained a bunch of weight, and by eating this way and changing her diet, it helped her lose that. But for a general person that's just overweight, that doesn't have a chronic illness, this may not be the key for them.
Yeah.
So, and I appreciate what you do, helping people manage chronic illness, and you're not some magical weight loss doctor.
Right.
Because it just doesn't work that way. Probably people that are a little bit overweight, and especially if they already eat healthy, maybe they just have a gene for being overweight. I don't know. But they maybe don't have T cell dysregulation and that molecular.
Well, it's not that.
All that.
Yeah.
Not that complicated when you're just carrying a little extra weight. So.
Well, we had this girl once that was. She lost 80 pounds, and so she was carrying 80 pounds, and her sisters were skinny. But she said, I forgot how she got referred to me, but she was like, I barely eat anything. And I was like, well, that's rarely true.
I remember you telling me
this.
Yeah.
And then when we looked, it was she's only eating wheat and dairy for the most part, but only very little.
Yeah, that's the way I was.
Yeah.
I probably would eat maybe 20 bites of food a day.
Yeah.
And I was full all the time.
Yeah.
Because I was eating junk.
And so when we got rid of those food sensitivities for her, like she lost all the 80 pounds. And we had another girl, she was actually a student of mine, not really a patient, back when I taught A&P, but I would tell them all this kind of natural stuff. And she lost 180 pounds. And it was just like, well, what are you doing? I'm like, she's always just like, I'm just doing what you told me to do. And so it's not weight loss, it's normalizing the body.
Right. And I like how you mentioned to me, and I try to share this with people too, is that everybody's body kind of has a weight that it wants to be at.
Right.
And I kind of knew this was my weight. I kind of scared people when I got this thin, because people that haven't known me for so long, like, they hug me and they're like, oh no, you're a bag of bones. And, they're like worried that I'm doing something wrong.
Yeah, you're all running a 5K
and I'm like, well,
feeling great.
Yeah, but I'm like, if you'd have known me back in the day, this is how much I always weighed, and this is my normal weight.
Yeah.
And so I think everybody's body is different, and sometimes you do carry the extra weight. And to me, it was all the inflammation that was going on. I mean, my fingers were bigger. Everything about me was just puffy and big. Yeah. For me.
Yeah.
Most people would look at me and go, well, you don't look puffy and big at all, but I felt that way.
Yeah.
So.
You know how many patients we have, and I don't have a good fix for it, but they all are like, my friends are worried that I'm getting too thin. Yeah. And I'm just like, but all your friends are chubby. Yeah. And they're worried that you're getting too thin. Yeah. But like, your weight is the average weight back in 1910. Mm-hmm. You are what everybody looked like.
But we're used to most people, most people have a muffin top because that's just the way it is. That's the way our society is now, that most people are heavier. So when you see somebody that's kind of bony, you do get concerned. Yeah. And then when somebody says, what are you doing? I try to always not say, oh, I'm on a special diet, because that sounds like I'm trying to lose weight. Right. So I try to say it in a different way.
I always try to, like, it should be lifestyle. I change my lifestyle.
I know, I've changed the way that I eat. That's usually what I say. I've changed the way that I eat. I found a new doctor, and I'm Crohn's free now. So. Yeah. And that could be you out there. So.
Well, and I like that you're a light of hope to other people now.
I hope so.
Because this sucks. I can't tell you how many patients that come in, their doctor's just like, you can't get help. It's not reversible. Mm-hmm. It's not your food. Just take your medicine until you die of a toenail infection or something. Right.
Well, and I have to do just a little plug for you so that people realize what he does. A lot of people don't realize, people that have never come to see you before, is that, you have to pay cash to see this guy, but do you know any doctor out there that will spend an entire hour with you for the money that you pay him? I don't. Yeah. And somebody who, and I know this firsthand from other family members, who, if he can't figure out what's the matter with you, will go out and buy a new textbook and stay up all night and read it to try to figure it out. This guy will. So it's just amazing. Some people will say, well, I can't go to him because he doesn't take insurance. Well, you don't have overhead. We call your cell phone to make an appointment because you care more about your patients than having a huge practice full of secretaries and all of that, and I appreciate that. I really do think that you would do this for free if you could.
I would.
I know you
Occasionally
would.
I do.
I know you. Because you do this for free. Yeah. And how many things have you done for free this week? You've been teaching kombucha classes and doing all kinds of things. And so you're never going to meet a doctor who cares about people as much as this guy. And so I appreciate that. And that's why you're so easy to refer people to.
Yeah. Well, thank you.
Yeah. And he's growing his beard back, by the way. I thought it might be a little freaky to see this naked face, but he's already bearding up.
There was like 150 comments about my facial hair.
That mustache was creepy.
That mustache was really bad.
Unless you're Tom Selleck or you have like this huge amount of lip that needs hair,
yes.
mustaches are not a thing.
That mustache was horrific, and patients when I would go get them, because I grew out to here.
Would they just not look at you?
They just laughed.
Oh my goodness.
They just laughed. And so I was like, I know. I said, I'm just waiting for 2 days till I see my girls, and then they're gonna be like, oh my God, Dad, you have to shave that off. That's disgusting.
Well, it's fun. Like Mike's had a full beard before, my husband, and it's fun when he decides to get rid of it because we shave it in only that evening for all the different, till we're down to like a Hitler mustache, and he's like, oh, get that off. But it's fun. But you're courageous because you didn't just do that at home and take pictures. You actually wore it. So you're a creepy Fu Manchu.
But Shanna thought it was awesome, so she was okay with it.
Oh, I think I saw her doing this to it. Like,
I know.
That's what I think I saw in that picture.
I know. You would have thought I asked some, like, really provocative... So she was making fun of me because she was just like, half the country's drowning, the other half's on fire, there's earthquakes, and... Well, what's his beard situation? Like, that's a real thing. So it was hilarious. But I love everybody's feedback. Yeah. And then we had some interesting, weird comments, too, though. But
yeah. Well, and Sarah earlier said that the next time we get together, I have to leap like a gazelle. So
you got to do a cartwheel.
That happened in week 1, by the way. I came running out of our bathroom and leaped into the bed, and my husband was like, "What are you doing?" I'm like, "I feel like a gazelle. I'm so light and airy because I'm not all bloated and crazy." So that's was cool.
Awesome.
It was fun. That was my first sign of hope, leaping like a gazelle into bed.
Awesome.
How's that? So, yep.
And your husband got his wife back.
Well, he says he has a new girlfriend now, and it's me.
Nice.
Yeah, and we've been together since we were 16.
Yeah, is that right?
Yeah, I'm actually more in shape and more with it now than when I was 16 years old.
Is that right?
Yep. So I guess I should say I feel like I'm 15.
Well, where's my thank you note from him?
Oh, I don't know. He's out of town. Maybe he'll get on here later and say thank you. He does think you're awesome.
Well, thank you for joining us.
You bet.
And thank you guys. And if we didn't get to your questions, we'll totally answer those too. And feel free to keep posting, but please share this, and so other people with like Crohn's, ulcerative colitis can feel like they can actually get help. Someone posted a Facebook message and said their daughter has Crohn's, and do we ever help patients, pediatrics with Crohn's? And actually, we have a 100% success rate with that, which hopefully one of those patients are coming on next week or the week after, and she's an amazing story as a kid. But yeah, it's nice because kids, it's easy. Mm-hmm. Yeah. Well, it's easy for me because I just got to tell them not to do all these things.
Well, you've helped a lot of people in our family.
They have to.
That's awesome.
So, if you guys, I never tell them my like number. So.
Oh, we should tell them your phone number.
Okay. So.
Or do you want the whole world knowing that out there?
Yeah.
Just kidding.
So my cell phone number is what I use for my office number, so patients can directly call me all the time.
I am looking it up on my phone. Like, like you don't know your
What
own
is
phone.
how old am I? I don't know.
You don't call yourself.
So it's so if you know anybody that has Crohn's or if they want help, like 316, it's still like an infomercial.
Yeah.
Yeah. 316-212-5429.
That sounds right.
Yeah. Or they can email me or Facebook me. Lots of patients Facebook.
Yeah, if you Facebook them, it's Patrick Garrett. No doctor in there, right? It's just Patrick Garrett.
I don't know. They're on Facebook now.
It's Patrick
It's this one.
Garrett, yeah.
It's Patrick. It's Facebook.
Yeah, it's just Patrick Garrett.
Oh, okay. Patrick Garrett.
Not Dr. Garrett, just Patrick Garrett.
So, so we have 2 more weeks. We're going to talk about miracle patients. We got some really interesting ones coming up too. But I'm glad you guys joined us, and can't wait to see your questions and comments. And thank you again.
You're welcome. Are you going to give me your Tough Mudder thing?
Oh, I don't know about that.
Yeah, you could split it in half and give half to me and half to Donna.
Okay, I will.
Okay, thank you.
That'll be awesome. Yeah.
All right.
And I get a headband.
A sweatband?
Yeah.
Well, then you should grow your
and a beard.
mustache back. You're going to wear a sweatband.
I do.
Yeah.
I'm going to wear a kilt.
And wigwam socks.
What's a wigwam sock?
You don't know what wigwam socks are?
No.
Oh, I'll teach him that later. We're over. It's 8:02.
All right.
Okay.
Bye, you guys.
Bye.